I was slowly becoming a hermit because of the rapid deterioration that was going on in my mouth. And I was actually more and more secluding myself from going out to dinners with my family, from wanting to have relationships with people, because I felt even at any time if I was to go out to dinner, I could be biting on something and maybe lose a tooth.
I've always had bad teeth, and I've always felt kind of bad about it. Never went through the orthodontia procedure that other kids did, and I've always felt kind of very self-conscious about my teeth, my mouth, my smile, and meeting new people. And as I got older, I just felt like it was showing more and more, and in social situations, I just felt very shy and not confident.
Previous to the dental procedures, I had started noticing that my gums were really bad, and I started having teeth falling out, and I couldn't eat, and it got to the point where and this went on for several years, this degeneration, and it got to the point where I couldn't eat very well, and then it got to the point where it was only soup and soft food, and I thought I've got to do something, but I just kept putting it off and putting it off.
Eating prior to the implants was very difficult. Basically what I did was I cut everything up. I ate everything with a knife and a fork. Apples, that sort of thing. It was always difficult to actually bite into anything.
There was some pain, but more importantly, there was infection occurring. And at that position in your mouth, gum infections can be very serious. And so I certainly wanted to correct that problem as soon as possible.
There'd been several issues with some of my teeth in the past, some root canals and so forth, and some teeth that were not able to be saved, and they'd been removed. In the back, of course, it's not such a big deal, but when we got to the point where I had one of the ones toward the front in the smile area that was missing, why that of course became a little bit more of a concern, and it was something that I had thought about for more than several years, of having something done about it and looking into what implants would entail.
I tried not to smile, but I just can't not smile. It's part of my facial expression. So I tried to keep my mouth closed. I couldn't, so I wore the mask. And people shied away from me. They thought I was ill.
They thought you had the swine flu.
My face was becoming very drawn, and I could see physical changes in my appearance, and I'm concerned about that. Again, at my age, and also worried that the more deterioration to the bone structure, eating in in another 10 years, 15 years, I didn't want to face that. To where you see people now that that have had that happen to them, and they can't even have dentures or anything in their mouth, and I did not want to experience that.
I was eating like soft rice, mashed potatoes. And if I was in a hurry and really, really hungry, I'd stop in the grocery store and buy baby food. And it was a sad, miserable existence.
Before I had implants, my teeth I had a major space in the front two, and I had a lot of problems with my teeth. I had small, tiny teeth. I would put my hand in front of my mouth when I smiled, and now I like to smile.